So good afternoon. As Caitlin said, my name is Leanna and my co-author Rebecca. Our presentation is based on a paper we're writing about state support for childcare during the COVID-19 pandemic in the United States. So the COVID-19 pandemic highlights what many, especially low-income families of color, already knew. The childcare system in the US is the broken foundation of the labor market. Our inquiry is into how have laws enacted in response to the COVID-19 pandemic supported and failed to support the world of childcare.
According to traditional perspectives of the welfare state, families find support for care in one of three places: the market, the family, and/or the state. On this view, the childcare system is comprised primarily of market care, such as daycare centers, family daycares, and nannies, with the state supporting market access for poor families through vouchers. When the law is brought into the picture, labor law is seen to protect childcare providers, while welfare law enables poor workers to access the wage economy by providing childcare subsidies for market care. However, this simplistic legal picture of the childcare system underemphasizes the role of the family and ignores the role of community in supporting families' care needs. This picture also excludes the centrality of race and gender in shaping childcare supports. However, when interrogated more closely through the lens of race and gender, we can see that the childcare system is, in reality, two bifurcated systems: a market-based system that serves mostly middle-class white women, and a community-based system that serves mostly poor, immigrant, BIPOC women. Both of these systems are dependent on the care labor of lower-income women of color. Additionally, a closer look at the legal regimes upholding these care systems reveals that labor law is an exclusionary legal regime working in tandem with welfare law to restrict access to full labor supports for poor women of color. We will unpack this more throughout the presentation.
So in our research, we are thinking about three communities, and they're all located in Massachusetts. Our choice of communities is deliberate to unearth how COVID laws are impacting communities differently along lines of class, race, and citizenship status. So the first community we're focusing on is Brookline. It's a largely wealthy, predominantly white community. The second is Roxbury, a working class, majority Black community. And the third is Chelsea, a community where most residents are Latinx and many live below the poverty line, and about 1/3 are undocumented. So for today's presentation, we'll just focus on Chelsea to paint a picture of the state of childcare in a community that experiences extreme vulnerability, but also resilience. So Chelsea is small, it's just under 5 square kilometers, and it's near the seacoast of Massachusetts. Its population in those 5 square kilometers is about 70,000, even though the census count is about half of that, and that severe undercount is because of the number of undocumented people in Chelsea. Historically, Chelsea has seen waves of immigrants, first Jewish, then Cuban and Puerto Rican, and now many from Central America. And Chelsea grew as an industrial city in the 1900s, which contributes to its very dense housing situation today. So as mentioned, about 20% of Chelsea residents live below the poverty line, 1/3 are undocumented, and of its working population, about 80% are considered essential. During the pandemic, Chelsea has also had the highest COVID infection rate in Massachusetts. It's about 6 times the state average. So we'll begin with a map of laws that show kind of the background picture of what's created vulnerability in Chelsea. And these include extreme dependence on the labor market to support themselves, in part because of work requirements to receive welfare. In addition, undocumented individuals cannot access major federal welfare programs because federal laws expressly limit eligibility to citizens and qualifying non-citizens, so they exclude undocumented individuals. Many Chelsea residents are confined to low-wage jobs because of language and credential barriers. And in terms of housing, zoning laws preference industry, and there's quite a limited supply of public housing. During the pandemic, job losses have heightened both housing insecurity and food insecurity. And in terms of childcare, families have limited options because low wages constrain market options, and there's a backlog to access subsidies for daycare. So these background legal and social forces create a situation of vulnerability and insecurity. And our interest is in how a set of COVID laws and interventions change this picture. So the foreground laws in our study are one, increased funding and flexibility for daycare vouchers. Two, expanded paid leave and unemployment insurance, which can support families in providing care. Three, expanded small business loans, which are now available to child care providers. And then we're interested also in how community has responded to care needs during the pandemic.
In trying to understand how COVID-19 era laws have shaped the world of childcare, we drew on the insights of Esveen Anderson's 3 Worlds of Welfare Capitalism. We find the concepts of commodification and familialization particularly helpful for understanding how families access childcare during this time. On this slide, we focus on commodification, or the degree to which families can support themselves independent of market participation. We find that despite the support of COVID laws and interventions, the combination of immigrant restrictions and meager economic support from the state leaves Chelsea families highly commodified and desperately reliant on the market for economic support. High market reliance, or commodification, has led Chelsea families to rely on family and community members, often themselves in precarious financial situations, to fill the care gaps left by the state. We also consider how COVID-19 interventions impact the degree of defamilialization experienced by Chelsea families. When policies have a defamilializing impact, they relax a family's dependence on kinship for welfare and instead strengthen the position of traditional caregivers, such as mothers. We find tensions between defamilializing policies as written, such as relaxed voucher requirements, expanded leave, and the establishment of emergency care centers for essential workers, and the lived realities of Chelsea residents. For example, for families who have access to paid leave, their high dependence on wages leaves them unable to take a 2/3 salary cut, or to accept 2/3 of their salary. Additionally, many Chelsea residents are undocumented, leaving them excluded from many welfare benefits or reluctant to accept benefits for fear of being deported. Finally, as a COVID-19 hotspot, Chelsea families directly witnessed the devastation that the pandemic could have on their community. This left many families fearful of sending their children back to group care, despite the financial sacrifice keeping them home entails. Both commodification and familialization have surfaced the creativity and resilience of Chelsea families when it comes to childcare. With support from the market and the state inaccessible or insufficient, Chelsea families find sources of caregiving from their community networks, such as neighbor care and intergenerational support.
So in this slide, we look at the impact of COVID laws on childcare providers, and we assess their position using the concepts of economic security and care flexibility in the next slide. So Esveen Anderson's terms of commodification and familialization felt like they didn't fit when it came to discussing care providers, in part because his concepts are more individualistic and suited to thinking about a singular family unit. But when it comes to care providers and considering their position as care workers, there's both an important individual and collective dimension. So first, in terms of economic security, care providers are generally in an economically insecure position because of low wages. During the pandemic, expanded state support for vouchers has provided some support. And there's also increased recognition that childcare is essential. So accordingly, government has expanded supports, including small business assistance supports. But in Chelsea, providers are less likely to access the support compared to providers in wealthier communities. Moreover, enrollment rates are falling as parents prefer to keep their kids at home, and some centers have stayed closed. So while some state supports have helped daycare providers weather the pandemic, many still face a baseline of economic insecurity. Next, in terms of childcare flexibility, providers in Chelsea have limited options, similar to the families they serve. Their low wages make market care unaffordable, and restricted access to state support like paid leave and unemployment insurance limits the resources they have to care for their own children. However, we've been struck by how care providers are embedded in community networks. Family, friends, neighbors, sometimes paid, sometimes not, provide care to one another. And these informal providers play a vital role in the networks of care that Rebecca described. So given the informality of care arrangements in Chelsea, a meaningful state intervention would be to recognize the importance and legitimacy and provide financial support to these existing family and community care arrangements.
As we conclude, we wanted to end by considering how legal reform might help the most vulnerable, who are also at the center of care provision. We also consider how the state should be involved in strengthening both access to care and the conditions of care providers. We offer, as a start, 3 suggestions. First, let experienced care providers lead. Care providers have a wealth of knowledge and should play a key role in reforming access to care as well as care work. Second, improve work conditions for childcare providers, including a livable wage, reasonable hours, and safe working conditions. And finally, support family and community care. Women of color should be supported to run their own care businesses, and all care providers, including informal community care supporters, should be adequately compensated. The state should be flexible and responsive in their recognition of care work, just as women of color have been flexible and creative in attending to their own care needs.